Welcome to episode 3 of our Chiropractic Assistant Training Program. Today we'll focus on one of the essential skills you'll need in your role: taking vital signs. Vital signs are a key component of a patient's health assessment and provide valuable information that can help guide their treatment plan. As a chiropractic assistant, it's your responsibility to accurately measure and record these vital signs during the patient's visit. Why are vital signs important? Vital signs include blood pressure, heart rate or pulse, respiratory rate, temperature, and sometimes oxygen saturation. These measurements give us a snapshot of a patient's current health status. Changes in vital signs can indicate underlying health issues that need to be addressed, referred to a specialist, or monitored closely. Before you begin taking the patient's vital signs, it's important to first measure their height and weight. These measurements provide additional context for the patient's overall health and are often used in calculating BMI, which can be relevant to their treatment plan. Ensure the patient is standing straight when measuring height and that they remove any heavy clothing or shoes when weighing. A normal BMI, body mass index, ranges from 18.5 to 24.9. After recording height and weight, ensure that you have all the necessary equipment ready and sanitized for taking vitals. This typically includes a blood pressure cuff, stethoscope, thermometer, pulse oximeter, and a watch or timer to count respirations and pulse. Always make sure the patient is comfortable and relaxed before taking their vitals. Explain each step of the process to help them feel at ease. For example, you might say, "I'm going to take your blood pressure now. Please relax and try to sit still." Let's start with blood pressure. 1. Positioning the patient. Have the patient sit with their arms supported at heart level, feet flat on the floor and legs uncrossed. Ensure the patient is relaxed as stress can affect the reading. 2. Applying the cuff. Wrap the blood pressure cuff snugly around the upper arm, just above the elbow. Make sure the cuff is not too tight or too loose. 3. Taking the reading. Place the stethoscope's diaphragm over the brachial artery, found just inside the elbow crease. Inflate the cuff until the gauge reads about 20 to 30 millimeters of mercury above the patient's expected systolic pressure, then slowly release the pressure while listening for the first and last sounds, systolic and diastolic pressure, respectively. Record the measurements immediately. A normal blood pressure reading for an adult is typically around 120/80. Next is the heart rate or pulse. 1. Finding the pulse. Use the index and middle fingers to locate the radial pulse on the thumb side of the patient's wrist. 2. Counting the pulse. Count the number of beats for 15 seconds and multiply by 4 to get the beats per minute. If the pulse is irregular, count for a full 60 seconds. Record the heart rate and note if the rhythm was regular or irregular. A normal heart rate for adults ranges from 60 to 100 beats per minute. Now let's move on to the respiratory rate. 1. Observing breaths. Without alerting the patient, as awareness can alter their breathing pattern, observe the rise and fall of their chest. 2. Counting breaths. Count the number of breaths for 15 seconds and multiply by 4 to get the breaths per minute. If the respiratory rate seems abnormal, count for a full 60 seconds. Record the rate and note any unusual breathing patterns, such as labored breathing. A normal respiratory rate for adults is typically 12 to 20 breaths per minute. Next is temperature. 1. Choosing the method. Depending on the clinic's preference, you might use a digital thermometer for oral, tympanic, ear, or forehead temperature. Make sure the thermometer is clean and has a new, sterile cover if necessary. 2. Taking the temperature. Follow the manufacturer's instructions for the thermometer you're using. For oral temperature, place the thermometer under the patient's tongue and instruct them to close their mouth until the reading is complete. For tympanic temperature, gently insert the probe into the ear canal. For a forehead thermometer, place it on the center of the forehead and move it across to the temple as directed. 3. Recording the temperature. Record the temperature in degrees Fahrenheit or Celsius, depending on the clinic's standard. A normal body temperature typically ranges from 97 degrees to 99 degrees Fahrenheit, 36.1 degrees to 37.2 degrees Celsius. Finally, let's cover oxygen saturation if applicable. 1. Using the pulse oximeter. Place the pulse oximeter on the patient's fingertip, making sure the nail is free of polish and the finger is warm. 2. Reading the results. Wait for the oximeter to display the oxygen saturation percentage. 3. Recording the oxygen saturation. Record the percentage along with any notes about the patient's condition, such as signs of respiratory distress. Normal oxygen saturation levels typically range from 95% to 100%. After taking all the vital signs, it's crucial to document them accurately and promptly in RapidDoc. Include any observations, such as irregular pulse or labored breathing, that might need a referral to the patient's primary care physician or cardiologist, for example. Proper documentation ensures the chiropractic team has a complete and accurate picture of the patient's health. Conclusion. Taking vital signs is a routine task, but it's also one of the most important aspects of patient care. Your accuracy and attention to detail can make a significant difference in the patient's treatment and overall experience. By mastering these skills, you're helping to ensure that each patient receives the best possible care.